We provide a transport service with the clinic. We also have a few support organisations in Mount Isa that will give us a hand. They're wheelchair access vehicles. Also, there's been modifications done to a few of our buses so those that are still quite mobile can access the bus. All of our sites wheelchair accessible. The planning and setup of the buildings is to accommodate those with wheelchairs, wheelie walkers, even small things like where we put water dispensers throughout the clinic are an easy access, so we make sure that we cater for them as well.
Health literacy is a major issue in areas out here where, you know, you could fly out to island areas in the Torres Strait and you'll meet people who have had 3 other languages before they've even learned English. So, you know, you've got to have material that explains health issues and you know, various conditions that we don't really cater for. So what we do is, you know, we get great pamphlets which are great, you know, if I'm someone living in the city and I've grown up with TV access and books and things all around, that's very westernised and it's great. But, you know, you go up there and you find there's a different exchange of ideas. So you might find that no one picks up any pamphlets because that's just not a cultural thing to do. Where do you go? You might call your auntie up the road and ask her about health. So if auntie doesn't know about Parkinson's in that example, well then you're left with a void and there might be confusion, you know, or they might have a different term for it. There might be a historical term for it. And I think that's, you know, part of like a discussion that needs to happen, you know, in terms of education.
I know quite a lot of our clients don't drive themselves. They rely on taxis or buses, and we have to be really mindful of that bus timetable and make sure that their appointment times fit in with that timetable. And we can't change that because that's when they can be here.
Well, it's one thing to change your practice and to change your physical environment to improve accessibility. It's another to change your mindset around what's your relationship over time and to be thinking around what it is this individual and their family and the context of their family and their place do they need from me, and what's my contribution, and then what's my role as an advocate or a networker, as a clinician who has the ability to network with other people on this person's behalf or with this person, this client, in order to make sure that they live a full life to their desire. And I think that's absolutely achievable.
Yeah, so I think the way that we can try to improve this is that moving forward, the whole team in the GP practices, the admin staff, the practice managers, the nurses and the doctors all need to come together, talk about the different types of patients we have, including ones with disability, and find ways to flag them in our software to make the receptionists aware that they may need extra support, and I guess find a way to actually document that in some way so it's actually accessible for everyone, that when this person does come in that they will need either a wheelchair or they will need someone to show them where the seats are or where the toilets are. I think definitely it's a new whole system approach that we have to do to change these processes to fix and improve, I guess, the health of these people with disabilities.
I'm a registered general dentist with a special interest in pediatric dentistry and special needs dentistry. We came up with a mobile dental van and we started servicing outback communities where there's no dentist. Whilst we were doing that, Queensland Health has asked me to see a few people in their homes because they cannot access the dental practice. So one, they're rural and remote. Two, they can't get into a conventional dental practice. So I started sort of getting some gear where I can bring it down and see them in the home. So it's sort of like an out-of-office patient care. And that sort of made me realize, if these patients need to see me in the city, where do I bring them? I work with the patient's GP. I tried to ring them, get their health information summary, because we're not just dealing with patients with a physical disability. You could have a patient with a mental health disability or an intellectual disability. When we get the appointments, we tell them, would there be any special requirements? It's just sort of like going to a restaurant and asking what food you would like to have. So when you ring, you start the conversation by the initial phone calls. So it's basically a chair. So if a person's bariatric, a lot of patients are afraid of seeing their dentist because they might break the chair. But we sort of reassure the patients that, look, this is an environment where you can sit in the chair and you don't have to worry about breaking it, and then we can recline you safely. Now, for people on a wheelchair, sometimes it takes away the dignity of the patient when you need to hoist them out of the chair and put them in the chair. So we tell them, let's remove the bariatric platform and just wheel into the chair, and then we just tilt them back. So it allows you to treat the patients more comfortably. But you also have to add in other equipment other than just the chair alone. So you might need a portable x-ray, or you might need some other portable gear, because some patients may require a general anesthetic. So if you are doing a general anesthetic, you should be able to bring your gear into theater and deliver the same service as what you would in your dental practice. When you say accessibility, you have to look at access and the ability. So access is, yes, you have the equipment, yes, you have the staff, but are your staff trained to handle the patient from the minute they walk down the door? It should be a welcoming environment.
It's important to spend the time with the patient and develop a relationship with them and rapport, because at the end of the day, that's what will make them want to come back and see us again. You want them to have the best experience. You want them to feel like they've gotten their money worth as well. I just put myself in their shoes and how I would like to be treated when I go to any sort of appointment. Everyone is different, everyone has different requirements and needs, so it's important that they know exactly what is being explained to them, and so we take the time to make sure that they're fully aware of what's required and what's needed for their dental health.
I think it boils down to training. So it starts with education, and then from there we could then show other practitioners that it is possible to achieve and deliver culturally appropriate care for people with disabilities. It should be timely, first and foremost, and it should be clinically appropriate.